Good morning, TGIF, and happy Halloween. In this video, I'm going to talk about Lyme disease. And just I saw a patient, second time, she moved from Nevada. She claims she has Lyme disease. She has no history of rash or joint pain. She said she has some study done in the past. I don't have any labs on her or anything, but I believe her that she might have Lyme disease, but I don't have anything to go by, but she's having some urticarial rash. She doesn't understand what's urticaria. I have to show her some picture, what urticaria looks like. She have mild urticarial rash. She moved to Central California recently. So I wanted to create this video. I mean, I can tell you is that is Lyme disease is one of the most misunderstood illness in medicine. I mean, I don't know why some people love to claim that they have mild disease, but some people like to have some labels applied to their other symptoms, which really are not because of Lyme disease, because of some other things, but they have been misdiagnosed, and they are then proven, then are told by other doctor that that's not the case. I don't see any evidence of Lyme disease, and they get really upset. And that was the case here. So I wanted to create this video about Lyme disease, why so widely misunderstood. So thousands of people believe they have chronic Lyme disease when in fact their tests or symptoms tell a different story. So today I'll break it down, the signs, the diagnosis, treatment, prevention, and most importantly, how to avoid false positives and unnecessary suffering. Again, the placebo effect and nocebo effect had a lot to do with it, and a lot to do with your belief system in this kind of chronic illnesses. Lyme disease is an infection caused by spiral-shaped bacterium, Borrelia burgdorferi. So Borrelia burgdorferi is transmitted to humans through bite of infected black-legged ticks. It's also called deer ticks. And it was first diagnosed in 1970 in Connecticut. That's how it got its name. And ticks pick up the bacteria when they feed on infected animals like mice or deer, then transmit to the humans through their bite. Lyme disease is most common in US, Europe, and parts of Asia, especially in wooded and grassy areas. What are the symptoms? Early symptoms typically start within 3 to 30 days after tick bite, and common signs include erythema migrans. It's a red shaped expanding bull's eye rash at the bite site. Fever, chills, fatigue, muscle pain, joint pain, swollen lymph nodes, or different combination can be seen. Not everybody get every presentation. If untreated, it can spread to joint, heart, and nervous system, leading to arthritis, especially in the knees, facial nerve palsy called Bell's palsy, irregular heartbeat, meningitis like headache or nerve pain. Diagnosis starts with a clinical suspicion, a known tick bite plus classic symptom exposure to those areas, deer ticks. But because symptoms mimic many other illnesses, lab testing becomes essential. A standard approach is two-step blood test. ELISA test, which is screened for antibodies for Borrelia burgdorferi, and Western blot test confirms positive ELISA result. However, antibodies may take weeks to develop, so early testing can be false negative, so follow-up is necessary. Later on, false positive also can occur because other infections or autoimmune disease that produce similar antibodies. Good news is that Lyme disease is curable in most cases. Early stage treatment is doxycycline for 10 to 21 days as the most common and highly effective antibiotics. Alternatives are amoxicillin, cefuroxime for those who cannot take doxycycline. Late stage or neurological Lyme disease may require IV ceftriaxone antibiotics for up to 4 weeks. Most patients recover completely with timely antibiotics. Fatigue, aches, and may last for weeks and months, and that's called post-treatment Lyme disease syndrome, PTLDS. There is no term called chronic Lyme disease. This has been diagnosed by lame people or quacks in our medical industry. In our medical establishment, there is no diagnosis as such recognized called chronic Lyme disease. So this patient told me that she has chronic Lyme disease because she believes, her chronicity of symptoms is because of Lyme disease. So this is where the confusion begins. Some people continue to have fatigue, brain fog, pain, neurological symptoms years after infection. And these symptoms are real and distressing, but in many cases they are not due to ongoing Lyme infection. Okay? Ongoing Lyme infection. Research show that no active bacteria are found after a standard antibiotic treatment. Yet many patients are told by, some specialist or Lyme specialist or something, based on non-validated test. They undergo months or even years of unnecessary antibiotic therapy, which can be harmful, causing gut microbiome damage, liver injury, antibiotic resistance. So let's talk about the false positive and misdiagnosis. False positives happen because ELISA and Western blot can cross-react with antibodies from other conditions like Epstein-Barr virus, rheumatoid arthritis, lupus, or COVID-19. Some commercial labs, they use non-standard Lyme panels that detect irrelevant antibodies. People often attribute chronic fatigue, pain, and brain fog to Lyme, where the real cause may be fibromyalgia, depression, psychosomatic symptom, thyroid disorder, autoimmune disease, and nocebo effect. One belief system has changed, then it's very difficult to change the mindset. This misdiagnosis not only delays correct treatment, also create emotional and financial strain. It is crucial to work with a board certified infectious disease specialist for proper testing and interpretation. And don't depend on primary care doctor, please. The best way to fight Lyme is prevention. Avoid tick-infested area or walk in the center of trails. Wear long sleeves, pants tucked into socks, and use tick repellents called DEET and permethrin. Check your body parts and pets after outdoor activity. Find a tick, remove them promptly using fine-tipped tweezers. So when you're going into a long hike with your dog, you should have all those instruments. And when you pull those ticks, there's a technique. You have to grasp the tick very close to your skin, and you got to pull it upward steadily, slowly. So don't yank it. Early removal within 36 hours often prevents infection. So Lyme disease is real, can be serious, but not every ache, pain, fatigue is Lyme disease. Accurate testing, early treatment, and prevention are the key. But you have any doubt, then see infectious disease. As I said, post-treatment Lyme syndrome is the term, and there is no official diagnosis called chronic Lyme disease because there's no chronic infection of Lyme bacteria in those persistent symptoms. A study have shown that. I'm not just saying because I want to say that. That's what a study shows. So, I think that it's important to get to see a proper specialist who has specializes in Lyme disease and is an infectious disease specialist, and get everything sorted out. So thank you for watching TGIF, and have a great weekend.